Okay, so good evening. Thank you so much, Lee, for that amazing presentation and all of the rich data that you provide to our communities. It's so valuable. My name is Kathy Sullivan. I'm the director of the Kent County Prevention Coalition. We are one of 7 regional prevention coalitions funded by the Department of Behavioral Health and Disabilities Hospital, sometimes known as BHDDH. Our mission is to prevent and reduce youth substance use and promote wellness across the lifespan. Each coalition is made up of community members from a variety of sectors, such as healthcare, schools, parents, law enforcement, young people, local businesses. And what we do is we work together to address the substance abuse issues in our community. And as far as challenges of youth that Lee just really very carefully outlined, we know that there are many challenges our youth are seeing, but adolescence itself is a challenging time for young people. And then compounded by all the other factors that we've talked about tonight. This past summer, we've had the chance to speak to countless parents over the summer months. We've been out and about in our communities with this campaign that I'm going to speak to at National Night Out events, backpack of school supply giveaways. And parents have told us how difficult the last year and a half really has been for them and for their kids. As you know, adolescence is a time for kids to figure out who they are, who they want to become. They're consumed with social media, fitting in, relationships, and now we have a global pandemic to add to that. And that's added to their isolation, anxiety, fear, just to name a few of the challenges for young people. In terms of some of the data, and I don't want to go too heavy because I know we're getting late in the evening, but our work is really informed by the data that we collect from young people. So what we know from young people is that their past 30-day use of alcohol, this is Rhode Island data from the most recent Rhode Island student survey data that's done in middle schools and high schools across Rhode Island. We know that the past 30-day use of alcohol rate for grades 9 through 12 is 17%. So 17% of our young people acknowledge that they're drinking alcohol. And we know that that rate is about 17% for use of marijuana during the past 30 days. And then Lee talked a little bit about the challenges for our LGBTQ plus youth. We also know that their rates of substance use is also higher. So their past 30-day use of alcohol is about 20%. So that's 1 in 5 young people. And their marijuana use, this is again in the state of Rhode Island, is about 24%. And then in terms of this is a little bit heavier, some of the data. This is recent data from the Morbidity and Mortality Weekly Report. And I won't go, I'm just going to leave that up on the slide. But essentially what we're seeing is there's a greater attempts of suicide in certain adolescent groups. So for instance, there was a 31% increase in ED-related visits amongst adolescents aged 12 to 17. We were noticing in May of last year, the counts for suicide attempts began increasing amongst adolescent girls. And then just to give you a visual of some of this increased data, what we see here is, this is 2019 data. This is a visual about suicide attempts and ED visits. This is 2020, the hash line here. But in 2021, where we are right now, this is where we're trending. And this is not just particular to Rhode Island, this is a national issue. So some of the concerns that have been raised by really doctors at Hasbro Hospital came to the regional coalitions. They raised some concerns about the data that I just shared, that there was a number of increase in youth suicide attempts with not just any medication in the homes, but with over-the-counter medications. So think ibuprofen, Benadryl, anything that young people could get in the medicine cabinet. And they really wanted the regional coalitions to address this issues. Now, regional coalitions are perfectly poised to do this. We tend to focus on risk and protective factors for adolescent substance use. We know that the more risk factors in a youth experiences, the more likely they may be using a substance. So some of the risk factors that a young person might have that have been heightened by the pandemic are family conflict, academic failure, a lack of a personal commitment to school, low neighborhood attachment, and that was all just challenged with the pandemic that we're in. We also know that protective factors are things that are in place in a young person's life that might make them less likely to use a substance. So we really, as coalitions, try to boost some of these protective factors. So some of this might be family connectedness, positive parenting styles, connection to school, extracurricular activities. And again, just think some of those things were taken away from them during this pandemic. So Hence, we see an increase in substance use, but also an increase in youth suicide attempts. As coalitions, we've worked really hard to increase the protective factors. We do this in a range of ways. We disseminate information, such as parenting newsletters. We also do evidence-based programs, such as Strengthening Families. Astrid is one of our Strengthening Families coaches, and maybe might be able to speak a little bit about that at the end of this. We also offer mental health first aid and QPR trainings like Lee has just offered. We educate not only parents, but teachers, faculty, school and community members. We also try to provide safe alternatives for young people to get them active and engaged in the community. We know that youth who have too much unstructured time or have long periods that they're unsupervised tend to be more likely to use substances. So in terms of youth suicide attempts, we know there are certain prevention strategies that really work and are effective in terms of reducing that. Some of that is preventing and mitigating ACEs. That's the adverse childhood experiences, the early childhood trauma that a young person might experience. We know that it's important to strengthen economic supports for families, make sure people have access to free and reduced lunches, for instance, during the pandemic. Limiting access to lethal means, and I'm going to get to that in a moment. Training to learn the signs of suicide risk, just as we just did this evening, increasing social connectedness and coping skills amongst young people. And I'm sure a lot of you do that all throughout your jobs in your interface with young people. And also providing safe messaging after a suicide. And I know we have teams of people that come into the schools if there's been a loss, and that is really, really important to handle that messaging correctly. But I want to talk about what the regional coalitions have been asked to do, which is limiting access to lethal means. Our coalitions really had a campaign called Count It, Lock It, Drop It. And that has been successful in trying to help reduce access to prescription medications and addictive medication, potentially addictive or fatal medications. And what we were able to do is we pivoted that messaging this past summer at the request of Hasbro and the Department of Health, given these numbers. And we came up with this campaign called Over the Counter Does Not Mean On the Counter. So what you're seeing on the screen now is one of the flyers, the messaging that we created. And really, this is just important messaging to parents to remind them that it's not just prescription medications, it's also the acetaminophen, the Tylenol, the Benadryl, that they really need to make sure that they secure so that young people don't have access to that. So we've put together this campaign, and we try to really saturate the market in different ways. What I've learned in prevention over the years, it's really hard, as Lee said, we used to use bumper stickers or refrigerator magnets. Now, with all the different modes of communication, you really have to use all those different avenues to convey a message to people. So we've had commercials on Channel 10, we've had use of social media, we've been using bus ads. Hopefully you'll be seeing some RIPTA bus ads. We are using radio, and all of the messaging that we've been creating it in English and also in Spanish. We've got Portuguese, and we've even translated some of it into Arabic for some of our partners in Providence. So this is the safety campaign. And with this campaign, what we're really trying to do is we're asking parents to change behavior. And I know as a parent myself, this is definitely a behavior change. I think we're all used to just having medicines freely available in the medicine cabinet. We also know that parents tend to buy things in bulk for economic reasons. So what we're doing is we are giving them lock bags. We're giving them the way to take that medicine and make sure it's secure. So we have been out in the community, and this is one of the lock bags here. And in the lock bag also contains a number of suicide prevention information to Kids Link, and other resources for parents. We want them to make their homes as safe as possible. So you can take that large jar of ibuprofen and just secure it in this lock bag, and put it somewhere in the house where your young person, your adolescent, can't get hold of it. There's some easy ways to get your hands on one of these bags, but what we've done is we've been trying to get them out to the community as much as possible over the summer, so people could go to our website, which I'll share that link in a moment, and actually order them online. And already 500 people in the state of Rhode Island have asked for a safety bag to be mailed out to them. And through our community outreach at different community events over the summer, we've distributed across Rhode Island, as of today, about 2,023 bags. All of this has been from additional funding from the Department of Behavioral Health, specific mental health grant funding that's enabled us to purchase these bags. We've been collaborating with our partners at the health equity zones to make sure that if they're doing farmers markets or other community events, that they're able to distribute these bags. As I said, we've got lots of other different media. We've got screens in medical offices. So just trying to extend the reach. I know RIDE has been a big partner in helping us to get this information out to their partners within the departments of education.
And Kathy,
So,
we actually
yes.
have Astrid actually said, I also suggest that folks use lock bags for electronic nicotine delivery devices, i.e.
Yes.
vape pens, Juuls, vape juices, and
Yes.
cannabis CBD products,
Yes.
and also to distribute them maybe to senior centers.
Yes, and I think that's perfect messaging. I think anything that's kind of risky, if you want to secure it and keep it away from young people, and like Astrid said, electronic cigarette products, vape products, and marijuana. I mean, we are in a very changing landscape around that. So I think any
And I
way
tell them
that
to tuck it away. I tell them to
Yep.
tuck it away. Don't just lock it up because, but hide it too.
Yep. Exactly. And so what we try to do as well with anything that we do around prevention, we try to track it to make sure that we're being effective. So I'm just showing you a little briefly about how people are finding out about the lock bag program, which social media sites, so that will help us in future to know where people are getting their information. So Facebook it seems like it's a very easy way to get information out to a lot of people, but we don't want to assume that everybody's on Facebook. There's an application called Nextdoor that the Rhode Island government uses, and a lot of people were able to access the information through there. So it's, again, trying to diversify the way that we get the message out to people. So if you had suggestions of other means to get that messaging out to people, I would welcome that. So what can you do? What you can do is try to remove access to fatal means in your home. So what we're trying to do is to get parents to access a lock bag and secure that medication. Put the large medication, the bottles, into the lock bag, and only maybe keep a small quantity of pills on the counter if you do need medication. And people do. People have medications in the home, and that's okay. We just want to make sure that we're not giving a young person access to something that could be fatal, or even just really detrimental to their liver as well. If you take too much Tylenol, it might not be a fatal dose, fortunately, but there can be other risky health effects of too much Tylenol and other over-the-counter medications. And then we're asking people to continue to drop off unused and expired medications at local drug take-back events. So we'll have one coming up in October. That's a national event. And you can also go into most police stations nowadays. They have drop boxes where you can just drop off any medications to get them out of the home. We really ask that people don't flush them because that's not environmentally friendly. And if you can't get to a drug take-back event, you can always put them in like a tub of like Tupperware or an empty margarine tub, put some coffee grinds in there. So that would help deactivate that medication. The other thing that we also recommend, if you do have guns in the home, to use a gun lock. And this site here that I can also put a link to it, Project Child Safe, is a list of all the police departments in Rhode Island where somebody can get a gun locked for the home. So that's not the primary messaging of this campaign, but it's another way to reduce access to fatal means in the home. And I think Lee has gone over this very carefully, but really listen to your teen, listen to your adolescent, even when they're not talking. That's something we can all do. Notice, be present, try to understand what's going on. And then if you do have concerns for yourself or for your teen, make sure you seek professional help. And I think Lee has given a lot of the places to get good resources, and that's very important. So I really appreciate your time. I know it's getting late this evening, but we are here for questions. And if you would like to access a bag, you can go to riprevention.org/campaigns, and you can sign up for either us to mail you a lock bag, and we'll put that in the mail for you in the next couple of days, or you can find out where we are going to be in the next couple of weeks. There's still a lot of community fall events that we'll be at where you can actually pick up a lock bag. So for instance, we're going to be at open houses, Rally for Recovery in the next couple of weeks. And this is across the state of Rhode Island. It's not just in the Kent region. So thank you, thank you, thank you. I'm going to stop sharing my screen so I can see everybody here. And I'm sorry that I whipped through that fairly quickly, but I feel like it is now 10 of 8. So I'm just cognizant of your time, and I'm sure you've all had long days. So any questions?
I did just want to say, one of the things that when Kathy was speaking is that I talked about pets earlier. And one of the things that I have some relationship with some veterinarians and vet techs in the world, and this goes to pets as well. If you go to, the veterinarian or the vet tech and, your pet is really not feeling well and they end up with a medication, that might just be on the counter because in your head is like, that's just for our cat or just for our dog or just for our guinea pig or, but it can also be something that's accessible to anyone else in the home.
Mm-hmm. Yeah. And also to mention too, I know it's unfortunate, but after there's been a loss, especially if it's hospice is involved, sometimes there's a lot of medications that can be left behind and people often don't know what to do with them. So they just sit. And we've had people attend drug take back events with literally duffel bags full of medications that are actually very lethal and unsafe, but they've just sat around for several months because people don't know what to do with them. So please remove those from the home as soon as you can.
One of my students many years ago in elementary school, his younger brother died because the grandmother had her medication on the side table. She was living with them and he took them and he was just a little kid. He was like a little toddler. And it was so sad. It just was devastating to the whole family.
Yeah.
So easily preventable if people had the knowledge to do that.
And for caregivers and parents of athletes who may be injured, who may be, or even post-surgical, oftentimes opioids are prescribed for a temporary pain relief. And of course, we know how addictive they are. There's actually an organization called Voices for Non-Opioid Choices. They do some really great work. They're really pressing forward and have had some success on developing a bill that would make it possible for doctors to have more than just opiates as a choice for people, especially for people in long-term recovery or for folks who may be concerned about addiction in their loved ones. And so that's a great organization because they're doing some good work about that. So.
And I would just like to say, this work that we're doing with the over-the-counter campaign, it's just one piece of a lot of work that we do. We do a lot of work around alcohol, marijuana prevention, vaping, but we always welcome help. So if you would like to get involved, you can also go to our website and find your local coalition. There will be one in your community, and your voice, your dedication, your commitment is really, really helpful. Sometimes we go to the State House and advocate for laws around tobacco 21, reducing access to cigarettes. And sometimes it might be just manning a table or womaning a table at an event and giving out lock bags. But we all hands together can help create an environment where young people are safer and healthier. So we can do this together, and it does really take a village.
Thank you, Kathy, and thank you for everyone who joined us this evening. Feel free to contact both Kathy or myself if you have any follow-up questions, and stay tuned for an email, which is actually going to have an evaluation survey attached and an opportunity to print out a certificate for your participation this evening. And we look forward to having you attend some of our future events for the mental health webinar series.
Yes, thank you very much. I appreciate it. Have a nice evening.